I'm Dr. Stephen Smith at Smith Facial Plastics, and I just want to briefly go over considerations of the functional nasal airway. We have a nice cartoon or diagram here which shows you the three things that we think of every time we evaluate a nose. Whether we're doing a cosmetic rhinoplasty or strictly functional nasal airway surgery, we're always considering these elements. The first is the position of the septum, and we can straighten a septum without changing the external appearance of the nose in most instances. This cartoon here represents a straight septum versus a deviated septum, and a septum is made up of 3 bony elements and 1 cartilaginous element, and any of those elements can be deviated or cause obstruction. It's a very straightforward procedure in most instances to correct. Then we consider a couple structures that live on either side of the septum called the inferior turbinates. We also have superior turbinates and middle turbinates, but when we think about the airway, we focus on the middle turbinate. And the middle turbinate, the inferior turbinate. The inferior turbinate is vascular tissue, and it tends to be very reactive, certainly to allergens and other environmental exposures. So we'll consider the inferior turbinate with most of our airway surgery and very, very conservatively reposition it, and sometimes conservatively remove some of the bony architecture that props it out towards the septum. And then the last element, which I'll bring up, is called the nasal valve. The nasal valve is something we didn't necessarily address with nasal airway surgery a couple decades ago, but now it's a very important part of what we do to help folks to breathe better through their nose. And when we think of the nasal valve, we think of the external nasal valve, which is the nostril, and then the internal nasal valve, which is this middle third of the nose. This middle third of the nose is where a breath can experience the greatest resistance in the entire respiratory tree. And there are wonderful structural grafting techniques, which means we use some cartilage from the patient's own nose to support these external and internal nasal valves.